So tell us a little bit more about psychiatric services on an outpatient basis with SOMC.
Okay.
You say you have some of that?
Yeah, we do. We have psychiatric nurse practitioners that are available to help with medications, and we have one therapist right now there. Just as the community is growing with therapists, we're kind of staying in our lane for the most part with medications and things like that.
Yeah. Yeah, still a resource. I know you mentioned like psychiatric nurse practitioner. I know we're trying to recruit social workers, but that's another, if you have that designation, you're probably going to have a job.
Yeah. Oh,
right?
yes. Absolutely.
Something that's definitely a need within the
Absolutely.
community.
Or be a psychiatrist. We are still interviewing for a psychiatrist, so we interviewed today, so we'll cross our fingers.
Best of luck, man.
Yeah, he's from Cincinnati, so that's not too far away.
We love when people come to Portsmouth, literally,
And we like
figuratively.
people from Cincinnati.
And we tell them
Reds.
it's really good. It's a good place to live. I mean, the cost of housing here compared to there, you can buy a really nice house and land.
Super
Minford.
nice house. I hope you're all looking at that. All the social workers in the region that might be, somewhere else. Right?
Yeah. If you're a service provider really of any type, I mean, I think that this is an ideal place to practice because like we were mentioning, getting to see the direct results of what you do. So this community is small enough where you're going to see how that impacts, but it's also got enough variance and need that you're going to have a job. You're going to, we're a growing community. So as that happens, like all sorts of service sectors will open up. And I think it's an ideal place to practice.
Sure.
Absolutely.
Yeah. So you were talking about, what the roles and responsibilities of the hospital are and what it's like to practice there. Tell us a little bit about where the hospital drapes off into where our services pick up and those kind of things.
So I'd say the closest point of access from the hospital is typically the crisis center. That's where Theresa and I do a lot of our communication. And when they get someone that may have been in the hospital for a couple of days or through the emergency department. And the way it works with the crisis center, per our state regulations, you have to have a medical clearance. You have to have a referral from a behavioral or medical
to make sure the
provider.
person's safe, to your point,
Absolutely.
right? So you got to make sure a person's going to be safe and appropriate
Medically.
for the next thing down.
Yeah. So we wind up working with them very closely when it comes to folks that need to access our services, and that works both ways as well. Sometimes we'll get someone at the crisis center that needs something a little higher that we don't provide right there on the spot, like a medical, like an MD, and we'll call the ER. And so there's a pretty consistent relationship through that program, and that has stretched throughout the counseling centers. We've grown and we've been able to open up access for more and more folks. And Theresa mentioned the withdrawal management center. So with especially the methamphetamine that we're seeing lately, like filtering throughout the community, that's a very easy access pipeline for the people that need it, which would be going to the hospital and then doing some time in withdrawal management and then stepping down maybe to the crisis center to figure out a medium to long-term plan for yourself. So I think that's probably the most obvious example I would name.
Yeah. What about some of those other step down nuanced things as far as being like, you had mentioned the mental health transitional house, but even like being able to, no matter what sort of level of care or program I might be placed in after like an acute hospitalization or whatever, it's like, what's the next thing down as to where it's like, being able to have mental health service access in every program that I'm in, no matter what, being able to access mental health therapy, on an outpatient basis only, right? So the hospital has some of that as far as psychiatric nurse practice and medications and those kind of things. What's the counseling center have?
Like you mentioned, the counseling center employs counselors, social workers for mental health through all of our levels of care. So if you are a client of the counseling center, regardless if that's in a medically monitored withdrawal management situation or a community outpatient situation, like you have access to a mental health provider. In response to the community need, we were very proud to open up mental health services to any member of the community that needs them through the counseling center over the last year. So the mental health is something that we're committed to as an agency. It's something that we've invested in to bring to the agency for our clients with our treatment philosophy. Yeah.
And most people think it's that you only do substance abuse,
that's
but you can just be pure depression. You're
Absolutely.
going through a divorce, you're going through a hard time, got some depression, you got some anxiety.
Sure.
That's, and of course, so many things go along with the eating disorders, all those kind of addictions that we all have. We all have something there. And so they can help help with that. But I mean, you've always kind of done that. But this straight mental health is new in the last, how many years? Yeah. I mean, new to if you've been around forever.
Well, and it probably started when the Adams Board, approached about, an opportunity for a partnership to reopen the crisis center. It's probably the first kind of domino that fell, and then from there, just increasing that service line up.
Yeah, it's been a very organic process. And when we talked about redesigning mental health for the agency a couple of years ago, the community outpatient piece was just an obvious point for us to try to devote ourselves to doing, because we get, and I've worked that job. That was my first job at the agency, is front desk taking the phone calls. Yep. And I can remember years back getting phone calls for folks that wanted to be seen for depression and having to refer those calls out. Yeah. And I know as a social worker, but also as someone who has family members that access services, like being told no is a big detriment to even seeking help. If you will, if I get up the nerve to make that call, and then sorry, I can't do that here. So
we're going to see you in 8 weeks or 10 weeks. So
so that's our goal: is access, availability, and just care for the community.
Yeah,
in that
so
respect.
the more people that do that,
and to your point, the field evolving and getting better. That there's not. There used to be like specialization practices, and now it's kind of taking the more social work approach where we're looking at being able to treat an entire person under one structure, right? I think that's
absolutely.
And those are the things I think that when people start doing that, it makes the entire field better, which is then going to make, like clinicians sharper. It's going to make agencies more well-rounded, and then it's going to lead to like better client outcomes and better community outcomes.
It's better understanding of what the patient really needs and what's out there.
Yeah.
So.
Yeah, absolutely. So what are some things like on the horizon that you guys are excited about that that maybe you would like to see continue to improve within the area as far as like the community's response to, mental health services, accesses, program developments, anything on the horizon that you're excited about or that you would like to see take place here?
I think that, we're doing some community work with zero suicide and trying to really get the word out to how to recognize suicidal ideations and what to say if you're a lay person. So there's a group of community people, counseling centers there, us and a lot more people are there to try to just make sure that people recognize when someone's depressed and what to say and how to help them get help. That's one of the things we're working on. Yeah. We're working on some stuff with Nationwide Children's that I'm very excited about.
Oh, wow.
Because we do have a children's population that needs to be served, and they're doing a lot of work with us in the emergency department and with our peds, and so we're real excited about some of the stuff they're doing.
Yeah.
Hopefully get to announce some things down the road here, but it'll be helpful.
Yeah, because that's a whole other, section of the community that needs served is the young people here. Right?
They do, yeah.
They should do something for the kids,
Yeah, those teenagers.
They really should.
And Nationwide built this humongous behavioral center, and they're just overwhelmed. But they are committed to helping educate communities. And so they're having their psychiatric psychiatrists, they're child psychiatrists, they're psychiatric nurse practitioners, they're psychologists. They actually came and met with some of the nurse practitioners that are seeing kids, and they would give education, and then we would do case studies, and I just got to listen in for the most part, and it was just fascinating. So their next step is to hopefully do some ER, so that we're making sure that we're assessing kids in the emergency department to the best of our knowledge base and the way they are doing it. So they're sharing things with us, and they unfortunately, we'd love to have a telepsych with children's, but they unfortunately can't do that yet. But that would be, an ER telepsych. Wouldn't that be amazing?
Absolutely.
That we had that. But that isn't something they have the capacity to do, but they have committed to providing education and grants for education. So we are going to be expanding that. Anything that they offer us, I've gotten their permission to invite the whole community because they're the ones that treat kids. Anybody that treats children in the area, that if Nationwide's going to do it, then we'll just offer it to everybody. Because we really see kids this much time in the ED. We're not the ones out there treating them. So it's been a great partnership. We've always been partnered with Nationwide Children's for medical, But now we're moving into the psychiatric. So.
I was going to say, sounds like it's picking up into another service.
Oh yeah. It's really. I probably talk to someone from Nationwide once a month. So I'm excited to see some of these things happen in the future.
Absolutely.
Oh, well.
Yeah.
What about you, man? Improvements or things you're excited about in the future?
Well, we mentioned mental health housing. That's something I'm very excited about. Excited to see where that goes because it's something that so many people need and have needed for a while. And
when you think about, you think about transitional housing, you think about people in a reentry situation, maybe coming out of an incarceration or a halfway house type setup, or somebody who's been in intensive kind of front end treatment that is transitioning into a lower level of care. You don't necessarily think about mental health diagnosis associated with that sort of thing. So I ditto, man. Yeah, totally excited.
I think that being able to bring that to the community and to the people that need it is, for me, the most exciting thing. Yeah. Sort of piggybacking off of what Theresa was talking about, I think that expanding services for juveniles is going to be a much needed service area. Yeah. Again, especially coming out of the pandemic and seeing the effects of that on folks. The counseling center has done that with our outpatient practice already. Yeah. We have Rhonda McGaw, who's an incredible LPCC, so gang affiliated. Yeah.
But, we like counselors too. I know we're heavy on social work.
Yeah, we do like counselors.
We like counselors too.
We do.
So having her start up a practice with the youth of the area that have come asking for services has been great, and I could see that growing. We've done some discussion with local school districts, and I think that we'll see some new programs grow out of that. So for me, also the most exciting thing is just seeing the level of awareness throughout the community. I have young nieces, and the things that they know and respect about mental health and mental health care just blows me away. It's stuff that I didn't hear about until I was in college. Yeah. And we're talking about, 13 and 14, 15-year-olds that are just fully aware of mental health parity and mental illness as an illness. Yeah. So seeing what comes from that as those folks start to get involved with people like us and find careers for themselves, I think we'll be looking at a more optimistic landscape for mental health care.
And a future generation of social workers.
And a future generation of social
right?
workers.
Yeah, hopefully, man. Yeah. Maybe it's in the family genes, you know what I'm saying?
Maybe, man.
Yeah. But no, I think that kids are definitely one of those things. And, mental health, just like substance use disorders, there's a stigma associated with it. And I think that now we're kind of starting to see some of that being pushed more mainstream. Famous people, one of those anomalies in the American culture. Once famous people start talking about issues, then the rest of us kind of have leeway to maybe not be as stigmatized by those kind of things or whatever. Just seeing more of that in the public eye and more of that in mainstream media and more ad campaigns at a state level and advertising and things like that. The zero suicide initiatives. I was watching the NBA playoffs last night and there was a mental health commercial that came on with national number or whatever. Yeah. So I think we're continuing to see more of that. And that's how communities get better, right? Address those prejudices, preconceived notions, stigmas, and then be open to what the professionals say that the community needs, right? Because I think that's a point to make is everything that we've talked about today, nobody just said hey, wouldn't it be cool if we did this? It's hey, we have this problem and need this to happen. Right. Right. It's
from the ground level of the people that see it and know.
Yeah.
Sure.
Yeah, absolutely. Yeah. So before we wrap up here, man, anything we forgot? Any final thoughts before we sign off, man?
Think of anything.
I think it's wonderful that even productions like this are out there educating people on what's going on in their community. I'm extremely thankful that Theresa joined us today.
Yeah, that's been cool. Thanks for inviting me. We rely on you a lot, so it's hard. If you call and ask me, it's hard to say no, Jonathan, because I'm constantly asking for favors from you. So we constantly have patients in the ER that, can you do this one? So we appreciate that collaboration.
Yeah, absolutely. And look forward to more collaborations in the future.
Absolutely.
Yep. All right, everybody. Thanks for tuning in. We'll see you guys next time.